Hey everybody, how are you today? I hope y'all doing well. I don't look well because I'm not feeling well, but I want to convey to everybody to please don't take your doctor's word for everything. Always get copies of your test results, your labs, everything so that you can keep on top of things. Doctors do not always tell you things that are seen on your tests. Case in point, I was in the hospital for a couple of days, and this particular hospitalist who was taking care of me, that's a doctor who works in the hospital. He takes care of the inpatient patients. He doesn't really have a private practice. He works for the hospital as an in-house doctor. So, he tells me 3 or 4 days in, you're healthy as a horse. Everything came back normal. So here I am. I come home and I get onto the patient portal of the hospital and I look at all of my labs, my tests, and what I saw was alarming. And I mean alarming. None of these tests were completely normal, and a lot of the findings explained some of the things that have been going on in my body. So I looked at the chest x-ray. I have questionable pulmonary nodules. Not sure what that's from. Um, it did state that we need to keep an eye on them if I'm a candidate for lung cancer, which I'm not because I don't smoke and I haven't been around secondhand smoke in a long time. But that was one thing. Then it showed something else called atelectasis, which is something to do with the lungs. Like parts of the lung is not getting enough oxygen. And then I also have atherosclerosis, which is plaques inside the artery, like cholesterol and stuff like that. Now, all of this stuff can cause different kinds of symptoms. I don't consider these normal results. Why this doctor would say that every single test came out normal, I don't know. Now, I am very knowledgeable in the medical field because I have been a medical secretary, a medical transcriptionist. I've always been very knowledgeable about all of this stuff. So I guess me, more than most people, I like to keep up with, my tests and my labs and all that because, I want to be healthy and I want to take care of myself. And then look how swollen I am today. I am so swollen all over. And anyway, I mean, come on. This stuff isn't normal. I mean, it's not, to a level of severity, but still, even having a mild to moderate case of plaque in your arteries, a lung that's not completely healthy. I have a hiatal hernia, a small one, but still, I have a hiatal hernia, and I have a cyst in my left kidney. So I'm like, you weren't going to tell me any of this stuff? And this has happened in the past, where doctors tell me my tests are fine, or they tell Dave that his tests are fine, and then I get a copy of it, and there are secondary findings inside. Like one time I had an abdomen ultrasound, and it showed past chronic pancreatitis. This is stuff I need to know, you know? So please be proactive in your health care. If you are able to, a lot of doctors' offices and hospitals now have what they call patient portals, where you can actually log in to the hospital or the practice and look up your lab results and your test results and everything. Be proactive with your health because your doctors are not always going to be on the up and up with you and tell you these secondary findings that are found. They may think it's nothing. And in ca- in point, my kidneys, okay? My kidney function has always been below normal, right? And none of my doctors have said anything about it. Now, it's a lab test called GFR. It has something to do with your kidneys, and it's always supposed to be greater than 60. Mine have been down in the 40s for years. So I've always had an element of mild kidney disease, right? When I went to the hospital, it was down to 31. That is dangerously low for kidney function. It got up to 53 by the end of my hospitalization, which is a lot better than 31. But just be proactive with your health because you can't always trust these doctors. So anyhow, I just wanted to convey that to you because it's very, very important. If you don't keep up with it yourself, you're not going to know that you've got certain things in your body that need to be addressed. So everybody take care and I'll see you next time. Bye.